Imagine this: a routine blood test is done. Nothing unusual, just a normal checkup. But 20 minutes later, the lab calls the doctor. They say, "Doctor, something is wrong. The patient blood is not red, it's green." Yes, it's green. Not brown, not dark red, green. Hi, I'm Dr. Raza, and you are watching Dr. Raza Health 360, MD. Today, we are discussing a real medical mystery, a condition where human blood can turn green. This sounds like a science fiction and alien stuff, but it's real and it's happened. Let's understand the science behind it. What should normal blood look like? Normally, human blood is red, bright red when oxygen rich, and dark red when oxygen poor. This color comes from hemoglobin. Hemoglobin contains iron, and when iron binds with the oxygen, blood appears red. So, for blood to turn green, something must change in hemoglobin. So, when blood turns green, in rare cases, blood can appear green due to a condition called sulfhemoglobinemia. This happens when sulfur binds to hemoglobin, and when this happens, hemoglobin loses its ability to carry oxygen properly. Instead of red, it becomes greenish. How does this happen? Sulfhemoglobinemia occurs when sulfur compounds enter the bloodstream. These can come from certain medications, environmental exposures, and chemical intake. Common drug triggers reported in medical literature include sulfur drugs, some migraine medications, certain antibiotics, exposure to sulfur based compounds. These substances chemically modify hemoglobin. Once sulfur binds, the color changes and oxygen delivery becomes impaired. Is green blood dangerous? Yes, of course, but usually not immediately life threatening. The main issue is that modified hemoglobin cannot carry oxygen efficiently. This can lead to fatigue, bluish skin, shortness of breath, low oxygen levels. In some cases, patients may appear cyanotic, meaning their skin may look like slightly blue or gray, even though the lungs are functioning normally. Now, difference from other conditions, you may wonder, is this same as blue blood conditions? Not exactly. There are other conditions like methemoglobinemia, where blood appears chocolate brown, but self-hemoglobinemia gives a distinct green tint to it. And unlike some reversible conditions, self-hemoglobin remains in red cells until the cells naturally break down, meaning treatment is different. So how rare is this? Extremely rare. Like, I am practicing for the last 20 years and no lab has called me about my patient's blood being green. So that's how rare it is. Only a few documented cases exist worldwide. Most are discovered accidentally during lab testing. Patients often have no idea. They may just come in for routine tests like pregnancy checkups, surgery preparation, journal health screening, and suddenly the lab notices something unusual. In reported medical cases, patients appeared healthy, no major disease. Blood samples showed abnormal coloration. Further testing revealed elevated self hemoglobin levels. After investigations, doctors often trace the cause back to medication use, chemical exposure, or unknown sulfur intake. So, what are the symptoms to watch for? Though these are rare, signs may include persistent unexplained fatigue, shortness of breath, grayish or bluish skin tone, low oxygen saturation without lung disease. Now, if a patient oxygen reading is low but lungs appear normal, doctors may suspect abnormal hemoglobin. So the diagnosis requires specialized blood testing. Standard oxygen monitors may not detect it accurately. Advanced lab analysis is needed. Spectrophotometry can identify self-hemoglobin levels. This confirms the condition. So what is the treatment? Unlike some hemoglobin disorders, there is no quick chemical antidote. Treatment focuses on stopping the triggering exposure, supportive care, monitoring oxygen levels. The body gradually replaces affected red blood cells. Over time, normal oxygen returns. So why this matters then? This case reminds us of something important. Even small chemical exposures, even medications, can alter the bodies in unexpected ways. Human biology is complex, and sometimes mysteries appear where we least expect them. So, what is the medical lesson here? Doctors must stay alert because rare conditions can mimic common problems. For example, low oxygen, fatigue, and cyanosis may not always mean lung disease. Sometimes the problem lies in the blood itself. So now let me ask you, did you know blood could turn green? I bet you didn't. Would you ever suspect it? Medicine is full of mysteries, and every unusual case teaches us something new. If you enjoy real medical stories like this, let me know in the comments. So I am Dr. Raza, and you're watching Dr. Raza Health 360 MD. Your better health is my mission. Goodbye. My name is Dr. Raza. I am a practicing family physician in USA for the past 18 years. I am an American board-certified physician and diplomate of American Board of Family Medicine.